Well, hello everyone, and welcome to our second concert hall event of the evening, the Political Party Roundtable. Now, this is the one and only all-candidate discussion on health care that will happen ahead of the June 7th provincial election. All 5 of our candidates for Kingston and the Islands are here tonight to address your concerns. And I welcome Sophie Kivala from the Liberal Party, Robert Kiley from the Green Party of Ontario, Andre Imbo from the Trillium Party, Ian Arthur from the NDP, and Gary Bennett from the Progressive Conservative Party. I'd also like to welcome the moderator of tonight's panel, Dr. Nadia Alam. Dr. Alam is a proud mother of 4 young children, a family doctor, and an anesthetist in Georgetown, Ontario. Her interest in medical politics began in 2015 with how the healthcare system and how government decisions were impacting her ability to serve her patients. She soon became a grassroots advocate, and this led to her involvement with the Ontario Medical Association, where she rose quickly to become first a board member and now a president. She is a published writer, master's candidate at the London School of Economics and Health Economics, Policy and Management, a media content producer, and an Order of Ontario nominee. In her spare time, she loves hanging out with the kids, hiking, reading, and singing. Please welcome Dr. Alam.
Good evening, ladies and gentlemen. Thank you so much for coming out tonight. I know healthcare is important to you. We all know somebody who's looking for a family doctor. We all know somebody who's waited for hours in the emergency department. We all know somebody who's been admitted to hospital and has been stuck in a hallway stretcher, cold, afraid, no privacy, no dignity, for days sometimes. We also know somebody who's sitting on a wait list for days, for months, for years sometimes. Health City is a place where we can have a conversation about what's going on with our healthcare system. Not just what's wrong with it, but what works in it. And try and figure out a way forward so that we can build it into something that's stronger and better. The government has a key role to play in that. The decisions they make have a direct bearing on the work that we do, that I do as a doctor, that people do the work that people do as nurses, as allied health, and the effects that patients see in the system that's trying to serve them. So, first, welcome to the audience. Second, welcome to the candidates who are brave enough to sit on the hot seat and answer some tricky questions. There will be questions that will be asked from the floor as well. And I wish everybody luck, and I wish everybody clarity, and I wish everybody an enjoyable evening. So the rules of the game: first, we're going to go through the candidates, give them 3 minutes to speak and introduce themselves and some of their ideas that they already have. Once they've gone through, I'll start going through some of the questions we've received from the Health City portal, from patients, from doctors, from nurses, from people all around the city, or all around Kingston and the Islands. We'll also take questions from the floor. Again, in an effort to give everybody a voice, I'm going to ask that if there are questions from the floor, I will limit you to a minute, just like I will limit the candidates in their responses to a minute. Otherwise, we'll be listening to speeches all night. All right, guys, let's get started. Gary Bennett, MPP candidate for the PCs. Let's start with you.
Thank you. Is this on? Yes, appears to be. First of all, thank you to the fellow candidates and everyone for attending this evening. And thank you for the organizers. I never thought I'd be on the stage of the Debaters Center, and thank you for that opportunity as well. This evening, after 15 years of Liberal rule, I suppose we could spend a lot of time talking about what needs fixing in our healthcare system. But this evening, I thought we'd rather focus on where we need to go and what's the best way forward in Ontario for our healthcare system. I can tell you a little about my background. I did sit on the District Health Council, which was the precursors to the LHINs, and I was also a member for 6 years on the local Board of Health, and I've sat on the Kingston General Hospital Foundation. But one thing I have done over the last 8 to 10 months after I was nominated is I've spent time in the community talking to a lot of people who are on the front care in the front line of our healthcare system in this community. I've talked to doctors, nurses, PSWs. I've even talked to custodians and porters in the hospitals about how we can make Ontario's healthcare system a better system. And I'd like to thank those people. I also came here a number of months ago to hear Dr. Andrew Picard, who's a leading writer on healthcare and in Canada, actually, talk about his prescription for a better healthcare system in Canada. So I've tried to do my homework, and here's my general conclusions. Overall, it seems as though healthcare starts at Queen's Park, and that tells me we've got the equation backwards. And I can tell you another thing that I know clearly does not work is turning the funding tap on and off for healthcare hasn't worked. We've tried it in the past. We know it doesn't work, and we need to acknowledge that and move forward. So we quite simply need to get back, in my opinion, to the basics of healthcare, of quite simply putting the patient first. The other thing I've determined and found is there's a lot of parts to our healthcare system, but the reality is it's not really a system. It's a remarkable collection of organizations and people who care about people in Ontario and are working hard, but a lot of times there doesn't seem to be a lot of communication between the parts, and I think that's something we really need to work on. The sort of symptoms I see of a healthcare system that's in need of more than assistance, it's approaching a crisis point of view, is we all know about the wait times in our hospitals and the fact that our emergency wards, in many ways, or emergency departments rather, are really the gateway to our healthcare system. We need to change that. All the parties seem to be trying to do each other in terms of the number of long-term healthcare beds we're going to build. But the reality is when I talk to people in the community, most people want to stay in their home. The idea of staying in a long-term care facility is always their second choice. I think we need more focus on community care. And the last thing I've determined is we have a real inability to share information across our healthcare system. And I find it hard to believe that after spending $8 billion on an e-health initiative, we still don't have a single comprehensive medical record for all the people in Ontario. But I think the bright spot in all of this, and we saw it through some of the discussions earlier today here, is in this region of Ontario, I think we've got a remarkable opportunity to provide leadership, not only in this community, but across all of Ontario. I know in this region we've developed things like waitlist software, we've developed care coordination tools. We even see programs in our senior apartments that really in many ways are making a model for the rest of the province. So wrapping up, I think this would be the challenge to not only my party, but to every party, and that's to make Ontario the healthiest place in Canada to live. And we should quite simply accept nothing less from the next government. Thank you.
Thank you very much.
Is this on automatically? It is, yes, look at that.
It's your turn.
Thank you. Tonight we are gathered on the traditional land of the Haudenosaunee and Anishinaabe peoples. Thank you for joining us. This election is the most important in a generation, and you, the voters, have a choice before you. I went to high school during the Mike Harris years, and I remember the teacher strikes and the layoffs of nurses, the hospitals closed, and the slashings of public services. By the time I was in university, it was the Liberals who were in power, and it was schools they were closing, minimum wages that they were neglecting, and hydro that they were making unaffordable. It's time for a change in Ontario, but what kind of change do you want? Tonight, I'm going to talk to you about our plan for change for the better in Ontario. If a patient must choose between keeping their home or paying for the life-saving prescriptions that they so desperately need, then we know that the government has let us down. If a mother must choose between putting food on the table or taking their child to see a dentist, then we know that the government has let us down. And if people must spend days and weeks in the hallways of hospitals waiting for treatment, then we know that the government has let us down. Ontario does not have to settle between bad or worse. And I know that as a province we can do better. When Andrea says that she is going to pass universal pharma and dental care plans, she is going to do exactly that. The reality is there are no shortcuts in healthcare, and cuts are worst of all. The NDP, we have an incredible plan. We're going to deal with the immediate health concerns of this community, but we're also going to address the upstream health issues that these many communities are facing. We will do this by creating a cleaner environment so that we can have a healthy society, by making sure that we have access to clean air and water for everyone. And sorry, access to healthy foods, available medicines, and preventative health care. But I think the most important thing is that we're going to work with doctors to build the best healthcare system in Ontario. We're going to work with you. I am here to ask for your support. I have 30 seconds. And a vote for the NDP in the upcoming election is a vote for a better healthcare and better government in Ontario. Thank you so much.
Thank you, Ian. Andre, your turn. This is the Andre Imbo, the MPP candidate for the Trillium Party of Ontario.
Thank you, and is this on?
Yes.
Okay, thank you, and thank you to the organizers, and thank you all for taking the time out of your evening to come out tonight and listen to us. So, in the Trillium Party, we believe that the government needs to be held accountable for what the government should be held accountable for. And one of those things is to look after the people of Ontario and to look after those who cannot help themselves. Over the last 2 decades, we've seen the PCs with their dramatic cuts to services, and then we've had the Liberals with reckless spending and mismanagement. And we think, frankly, it's time for change. It's time for something different and something better. We need to reduce the waste in our healthcare system because, frankly, we don't have a problem with a lack of funding in healthcare. We have a problem with that funding being used inappropriately. So what I mean by that is 60% of your healthcare dollar goes to administration, and we believe that's wrong. It should be the other way around, where service delivery and patient care should be receiving the bulk of the funding. The local health integration networks, the LINs, count for $90 million a year of waste. They duplicate the functions of the hospital board of directors, they duplicate the Ministry of Health, and frankly, it's time for them to go by the wayside. We need to change the model we use to fund our hospitals to reflect funding based on services actually performed. Because we believe everyone has the right to be paid for the work that they do, and that includes our physicians, that includes our nurses. So, as opposed to giving our hospitals a lump sum at the beginning of the year that's expected to last the full 12 months, we'll give a lump sum up front that covers the basic operating expenses of the facility, and then for each patient they see, we pay the hospitals per service rendered. That way it's fair. We're ensuring our physicians are getting paid appropriately. We're ensuring that the hospitals aren't going to run out of money partway through the year and have to close beds or cut staff. We believe in investing in our frontline staff who provide, quality care. And I believe everyone working in our healthcare system is devoted to patient care. And they give so much, they dedicate their lives to the people of Ontario, and we need to give back and ensure that they're taken care of. That includes making sure that, that staff are protected from assaults, that staff are given adequate rest periods, that staff aren't overworked and looking after too many patients. We also believe that, that hospitals should not be the primary point of contact with our healthcare system, and that we need to further invest in community care to ensure that every Ontarian has access to a family doctor.
All right. Now it's Robert Kiley, who is the MPP candidate and deputy leader of the Green Party.
Thank you, Nadia, and thank you to the Health City team who have invited us here tonight, and to you, the audience, for engaging in this most important and frankly most expensive of topics in provincial politics. 6 months ago, I was in your spot, literally sitting in those chairs. And I was listening to another health policy discussion on this stage, and that was a conversation by Andre Picard. Many of you know him as the Globe and Mail's columnist on healthcare. Many of you follow his work, follow his Twitter account. And in the many and wide-ranging things that he talked about in reforming Ontario's healthcare, he came to a startling conclusion. And he said, without mincing any words, that healthcare in Canada, healthcare in Ontario, requires us to move away from the status quo and requires a political revolution. And as Deputy Leader of the Green Party of Ontario, I can tell you that the Green Party's vision for healthcare is that revolution. So why is it that? It's because we think of healthcare holistically. All aspects of a person's life, at all stages of their life. And we use the lens of life cycle analysis to think through where and when people get care, how much it will cost, what it means to them as individuals, and what it means to us as communities. And we've come to the conclusion, as many health policy experts here at Queen's as well have come to, that community care is the most socially responsible and most financially sustainable model of care. And that's what we do at the Green Party. We think about communities and people first. Our policy is also revolutionary because we think first about the social determinants of health. I think of a paper done down the road at the School of Policy Studies that showed us that 75% of a person's health outcomes come from where they live, what they eat, how much income they earn, and only 25% of health outcomes come from their interaction with the healthcare system. That's why I'm proud to say that the Green Party is the only party that has a robust plan for a basic income guarantee to be implemented immediately upon our election, that we have robust plans for nutrition programs in schools, and of course, programs to ensure that all people have a place to live through a Housing First affordable housing plan. So that's what Greens do. We do politics differently. We see that in legislatures across the country where Greens are elected. 2 in PEI, 3 holding the balance of power in British Columbia, 1 in New Brunswick, and with your support, we'll do politics differently and bring the political revolution in healthcare and all public policy to Ontario. Thank you.
Thank you,
Last
everyone,
but
for
not
being
least.
here today.
Oh, sorry. Go ahead, Sophie Kiwala.
Thank you. Thank you, everyone, for being here today. And thank you to the organizers as well for putting on this tremendous event. I think it's very important that we do have holistic conversations about healthcare whenever we have the opportunity. Before I get into my remarks, I do want to acknowledge as well that we are on the traditional lands of the Haudenosaunee and the Anishinaabe. And I would also like to bring forward that I hope that we always, since this is the first debate, conduct ourselves in a good way, which is what their advice would be. And I think it's always important to begin our framework with that in mind. We have made an awful lot of investments in healthcare over the years, and I think it's important to bring forward what some of those investments are and some of the commitments that we have made in our budget. And I'm just going to go through a few items. We have invested in our budget $822 million in additional funding for hospitals and $2.1 billion over 4 years for mental health care. This is something that hasn't been mentioned so far, and I think that it's very important. Even if you are healthy physically, but you don't have, you're not healthy mentally, that's a terrific challenge. That's when life can become too much for some people, and that's something that we need to work on. When we do have positive physical health care and negative mental health care, we encounter problems like we're seeing today with the opioid crisis, and this is something that our party is very concerned about, and we are taking measures to combat that today, even in Kingston and the Islands. 94% of Ontarians are matched with a doctor, and these are the best median wait times in Canada, and we are also the first province to measure. So we are increasing the transparency with respect to the wait time process by making sure that it's transparent. We have added more than 6,000 doctors, 28,000 nurses. 11,000 of those nurses are RNs, and they have come into being since we took power in 2003. We have the OHIP Plus program, which is already paying dividends for individuals who are under the age of 25 right now. Over 4,400 medications are free for Ontarians. Locally, we're seeing the $500 million investment in Kingston Health Sciences Centre. That's a huge investment in our community. We contributed $7.4 million to the Street Health Clinic. As your MPP, I have been present, a grassroots representative in many, many areas of our healthcare system. I have advocated for our healthcare system and researchers on my show on Cogeco Cable TV. I have visited all of the sections of KGH which will be remodeled.
Wrap up,
Labor and
please.
delivery. Thank you.
So thank you very much for everyone for those introductory remarks. We're going to go on to the fun part and get on to the questions. To remind the candidates, you will have 1 minute to answer the question. The first question will start in the order of speakers, and then after that we'll rotate through. It'll be Andre with the next question who's starting, or sorry, Ian with the next question that's starting, and then Andre, and then Robert, and then Sophie. Okay, and that way everyone will get a chance to be first in the hot seat at least once, if not more. And again, when you have 10 seconds remaining, I'll hold up my hands, or perhaps I'll cough discreetly into the microphone, especially if you're not looking at me. And that'll give you 10 seconds to wrap up, and then I'll just cut you off, okay? All right, let's get started. Speaking of wait times, recently there was a report of a patient being told that there was a 4.5-year wait to see a specialist in Kingston. Currently, it is not uncommon to wait 6 months to 2 years to see a specialist. But these wait times are getting longer, and they do lead to patient suffering, anxiety, and increased trips to the emergency department and family physician for stopgap measures. Gary, how do you plan to address these wait times?
Well, thank you very much. Well, the wait times in our hospitals are caused by a variety of reasons. One is certainly the backlog of people who are in beds in our hospitals who quite simply should be in other care facilities. And at times, I think we've got solutions to some of the problems. I mean, I know when we shut down the St. Mary's at the Lake Hospital, I wasn't sure why we couldn't have kept that running on an interim basis to move many of those patients over. And I'm not sure if that conversation ever occurred, but it probably should have. The other issue in terms of wait times is there's too many people showing up at the doors of our emergency wards, and whether it's for dental care, whether it's for mental illness issues, or quite simply people in search of a doctor because they don't have a doctor. I know one of the previous speakers indicated that 94% of Ontarians don't have or do have a doctor, but I'm interested in representing 100% of the people in this province, not 94%. So I think until every person in this province has a doctor, we've failed them. So there's a variety of solutions to the wait time issue in Ontario. It's complex, it will take time, but I think it's important to recognize where the problems are.
Thank you. Ian, please go ahead.
Thank you very much. You know, wait times are at an unacceptable level, and the Liberals have had 15 years to get a handle on them, and Doug Ford is promising cuts and more cuts, which we know means that we're not going to get a handle on wait times. There's arbitrary cancellations of surgeries. It just doesn't really make sense. Our plan, we're going to start properly tracking and publicly reporting wait times so that we know how long people are waiting for surgeries. We want to initiate an overall strategy to reduce wait times and increase funding. We're going to make sure there's enough staff too. You know, someone in Ontario goes into an emergency room once every 3 minutes for dental-related issues. If we're able to launch our dental plan, we're going to lower wait times just because of that. Same with our pharmacare program. It's going to take care of a lot of people, and it's going to alleviate pressures in other places in the hospitals.
Thank you. Andre, please go ahead.
Thank you. And, you know, as I mentioned in my introduction, and as Gary alluded to as well, we have too many people showing up to our emergency departments with not necessarily, life-threatening or emergency issues. The emergency rooms should not be the first point of contact for the healthcare system. We need to ensure that every Ontarian has access to a family doctor. We need to ensure that every Ontarian has access to an after-hours urgent care center. Because at the end of the day, these people showing up to emerge with non-urgent issues are, one, clogging up the system, resulting in longer wait times, and two, it costs significantly more money to see someone in emerge versus seeing someone in a community clinic. We also need to address people coming in with, things like dental issues or mental health issues. Again, these are services that are not necessarily services that should be performed in our emergency rooms.
Okay, thank you.
I think tonight you'll find that many of the candidates, perhaps all of us, agree on the issues. ER being clogged up, definitely. Hospitals with people in hospital beds that could be in other facilities, definitely. The real question is, how do we address these concerns? Greens always look to the best evidence. We look to the experts. We look to the people in the field who deal with these issues to give us direction of where to go. We want to have good public policy. I'll give an example. Chris Simpson, who many of you know, who's out of Queen's, a physician and an acting dean at Queen's, just published a paper yesterday about the importance of a senior strategy in Ontario to make sure that elderly individuals are not in acute care beds in hospitals when they could either be in long-term care facilities or in home care. And that's precisely why the Green Party is committed to investing in community-based care, which includes long-term care and home care. Another example would be the good work of the paramedics in Frontenac County under Mr. Charbonneau, and paramedics checking in to make sure that people are living well at home.
Thank you very much. And what you brought up as your question was, how are we going to address specialist wait times? And I would like to be the only candidate to actually answer that question. We've all spoken about other things which are important because it is a healthcare system, unlike what one of the candidates said that it is not. It is a system. I saw the social media that you were talking about with the specialist, and I would have hoped that the person who posted it would have come and said, hey, this is what I just received. Can we talk about this? And what I would have done at that point would have been to talk about that with my ministerial colleagues at Queen's Park. I think that it's extremely important that we address this as a system. Some years ago, we had a shortage of family doctors, and there were a number of family doctors who are currently practicing here now who received... Too short.
How did that feel? 1 minute's really short, right? Yeah, it's not going to get any longer. Sorry. I want to get through questions today. Now, if anyone does have questions from the floor, oh, excellent. The gentleman in the purple shirt. Let's start with that. And then I'll keep going down my list as well.
Up to 1/3 or more beds in our hospitals are occupied by elderly people whose health is worsened every day that they are there and block access to beds needed by people with short-term acute care problems. Hospital beds cost taxpayers much more than a bed in long-term care, a retirement home, and many times more than being at home with comprehensive home care. If elected, what will you do to fix this expensive and cruel problem?
Thank you. We'll start with Ian, please.
Excellent question. We, in the NDP, we're going to invest in 40,000 new long-term care beds, 15,000 of those in the first 5 years. We're going to update the patient's bills of rights so that when couples need to go into long-term care, that they have the right to stay together and that they're not going to be split up. We're going to launch a find and fix inquiry into long-term care in Ontario so that we can look at the problems that are happening in these facilities that currently exist. Someone just earlier said to me that they would never want to go into long-term care. And I think that's a failure of the system. I think that we need to make long-term care facilities somewhere where people do want to go and understand that it's welcoming and that it's a safe place for them to go, that they're not going to suffer from abuses if they go there. Yeah, thank you.
Andre?
Thank you for your question. So, our first priority will be to build up a robust home care program to ensure that people can stay in their homes as long as possible. Because when a senior or somebody in need of long-term care can stay in their home, it improves their mental health. It breeds a sense of some degree of independence, regardless of how much care they may need. There's still a sense of independence of being able to remain in your own home. And for those who, for whatever reason, cannot remain in their own home and need to transition into long-term care, we need to ensure that beds are available and that the facilities are adequately staffed to ensure that every resident is receiving the correct amount of care. Right now, in some facilities, a PSW has roughly 7 minutes per patient to get them ready in the morning, and that's unacceptable.
Thank you for your question. I'm the former executive director of the Council on Aging in Frontenac, and I was able to see a lot of amazing work that is being done by grassroots organizations here in this region. And one of the shining examples was the Oasis project, which, for those of you that don't know, is placing a physio or a PSW or a community support worker in a senior's apartment complex. And that gives the individuals living in that complex a resource if they need it for care. It gives them connections with community, and it brings them together in a way that allows them to live at home longer, and therefore they don't find themselves moving into our institutions as quickly as others not in those environments. So we have a Made in Kingston solution to a provincial problem, which I'll happily advocate at Queen's Park. And the Greens also, as I said earlier, believe in community care. And one of the things that we think about community care is to tell people that long-term care.
Please wrap it up.
I'll finish that at another time. Thank you.
Thank you, Robert. You brought up something that I was going to bring up as well, the Oasis project. I did advocate for this project to be extended across the province, and we have provided funding for pilot projects, one of which is currently underway right now in Toronto, and we will be bringing forward more pilot projects across the province. Oasis is an excellent opportunity for seniors to live a more vibrant, more engaging lifestyle. Their social isolation is reduced, and we do actually have a senior strategy as well, which I will certainly be chatting with Chris Simpson about. And I think that looking at our communities and developing local responses to issues in healthcare is very important. David, as we have spoken about before, it's important that we build a capacity wherever we can, whether it's alternative seniors residents or naturally occurring like Oasis or other opportunities.
Thank you. Gary, your turn.
Thank you for your question. I did indicate earlier that one of the questions I posed in the community and I haven't got an answer for is we could move people out of the Kingston General Hospital and place them in the St. Mary's of the Lake facility, even though I know it's a tired facility. It accommodated this community for many decades, so we have infrastructure in this community that we should be utilizing, and perhaps there's a reason why we're not. The other issue is if I was a Minister of Health, I'd go out tomorrow and I'd hire 1,000 PSWs to start ensuring that we can build better capacity for community care. A little while ago, I had an aging relative who unfortunately spent their final days in a hospital, and there is no dignity dying in a hospital. And every day I would go in to visit her, she would say to me, "I want to go home." She didn't want to be there. She wanted to be in her home. And that's where the focus needs to be. We need to have more focus on community care and less focus on institutional care. I know the other parties here are all going to talk about their plans. The reality is Mike Harris had plans, and they failed this province. Bob Ray had plans, they failed miserably, and the Liberal government have had 15 years to fix the problems in our healthcare system. They have plans too. They're not working, we all know it.
Please wrap it up. Thank you. All right, I'm going to go down the list now. There are an estimated 800,000 people in Ontario who wish to have a family physician, but are not able to access one. That's 1 in 13 people. Look around you. Guaranteed someone here probably doesn't have a family doctor. There is a government program to help connect people to family doctors. It's called Healthcare Connect. Unfortunately, people often wait for years on Healthcare Connect before they can actually get tapped to be lucky enough to get a family doctor. We're going to ask our candidates tonight, what is your plan to manage the crisis in primary care? We don't want to end up again where we were in the 1990s, where 1 in 4 people did not have a family doctor. So we need to look at this issue now, and we need to look at this issue in a sensible way. Andre, we're going to start with you today.
Thank you. So while I acknowledge that the current Liberal government has hired a substantial number of doctors, it's still not enough to meet the demands of this province. So if we're in a situation where we don't have enough qualified doctors within Ontario to meet the demands, I do know that there are a lot of very qualified immigrants from other countries who would love to practice medicine here, but are unable to do so because of the overregulation. Currently, an immigrant from another country would have to go to the US, complete additional courses to become certified to practice. Meanwhile, they're becoming established in the US while they're doing their schooling, and a lot of them don't come back. So we would like to create a Made in Ontario solution to allow immigrant doctors to practice here in Ontario sooner with less bureaucracy tying up the process.
Thank you. Robert?
To increase access to primary care, to answer your question, we want to empower nurse practitioners and pharmacists to do some of the things that family doctors traditionally do. So in 2016, pharmacists were able to immunize to a certain degree. We want to expand that scope. We want to allow nurse practitioners to lead family health teams, and that will allow people in the province to get primary care quicker. Also, we want to incentivize doctors to geographical locations where they traditionally wouldn't go. The Liberals, to their credit, have started doing that by a student debt relief for doctors who will agree to practice rural medicine. We want to continue that, we want to further that, and we want to look at other areas that are underserved to see if we could offer similar incentive structures to make sure that everyone can access a family doctor when they need to.
Ooh, with 10 seconds to spare. High bar to set. Sophie, your turn.
I'm not going to try and beat that one. So it is a great question, and I am glad that we have Healthcare Connect. I have been concerned on occasion that people who put their name on a list don't take their name off a list when they get a doctor through that facility. I think that that's maybe a little bit of an issue, and in fact I've been so concerned about that if I have the opportunity to move on, I will be looking at building a system that is very local, that will really monitor who's on there from Kingston and the Islands, and when they get a doctor that they are removed. I think that that's very important. We have also supported an additional 50 medical students to support them through their schooling and make sure that they have an opening to go to the Academy of Medicine. I'm glad that Robert brought up the nurse practitioners and the pharmacy prescribing. Thank you.
Gary, your turn.
Thank you. This is a case where I think Catherine Wynne and the Liberals are trying to solve the problems that they create. They did reduce the number of residency opportunities in Ontario, and then as we approached election, they reinstated them. The real issue for everyone in Ontario is everyone should have the right to a family doctor. I can tell you, as the mayor of this community many years ago, I lived through the Mike Harris years. I know what cuts do. Cuts don't work. I lived through the Bob Ray years. I know what doesn't work. The reality is that I think as politicians, we need to be spending more time listening. But I'll tell you one of the programs that worked really well when I was the mayor, because it was more of a crisis for doctors. It's always been a crisis in this province. But we established programs by which we worked with the municipality worked with the province to attract doctors. We actually did advertising, we did outreach, and we worked really hard. The first thing we did is we tried to identify the need in our community for doctors. What's the shortage? Are we missing one doctor, 10 doctors? Am I out of time?
10 seconds.
Oh, 10 seconds, okay. Anyways, I know when I lost my family doctor, I was horrified. I didn't know what I was going to do. My family doctor lived beside me. I got really spoiled. And when I lost my family doctor, it took time for me to find a doctor.
Thank you. All right.
Thank you.
Last but not least, Ian.
you know, after 15 years of liberal neglect and frozen budgets, there is a shortage in this province. And we do have a plan, and we are going to talk about it. It's fully costed, it's online, it's 100 pages long. And I wonder what Mr. Ford's plan is, actually. But what we're going to do is we will raise funding for community not-for-profit health centers by 5%, an increase of $30 million. And then we're going to invest another $30 million in community care and open 35 new community care facilities to deal with this wait list. Thank you.
Oh, 30 seconds to speak. Wow. All right. I'll take a question from the floor. Gentleman in the back. Popped up like a jack in the box. It's impressive.
Thank you. Dennis Doyle. I'm the chair of the KFLNA Public Health Board. And I want to thank each of the candidates here tonight for meeting with me personally over the last 2 weeks. The prime purpose of public health is to keep people healthy and out of the hospitals, doctors' offices, ambulances, and so on. Inactivity and poor eating habits work against our goal, causing many illnesses such as diabetes, cardiovascular conditions, costing the healthcare system billions of dollars in unnecessary costs. Much of those poor habits are preventable if we start early enough in life, beginning with breastfeeding all babies. My question is, if elected, will you support bringing back more mandatory physical and food education in schools from kindergarten through grade 12? There is well-documented high return on this investment.
Thank you very much. And thank you for taking the time to advocate to the political leaders in town. All right, I'm just going to reset the timer. And this time we're going to start with Robert.
Thank you, Dennis, and thank you to the Health Unit for your continued advocacy on these fronts. The answer is, of course. The Green Party's platform for the last 3 elections that I've run as a candidate has always included mandatory physical education from K to 12 in schools. We've recommended 1 hour in the past, but have recently reassessed and said, let's go with what the experts say. So right now we're looking at 30 minutes, and that would be good for teachers to integrate that into their curriculum and into the classroom. We're also always pushing for robust school nutrition programs, as I said at the beginning, and we want to increase physical activity through active transportation. For example, increasing the percentage of the Ministry of Transportation's budget, which goes to active transportation, including cycling and walking infrastructure, from 1% to 5%. Likewise, we want to increase the...
10 seconds.
10 seconds. The answer is yes. Please read our vision, gpo.ca/vision.
Nice wrap up. Go ahead, Sophie.
Thank you. And I'm very glad, Dennis, that you have given us that question. Happy to see you to discuss this with you as well at the campaign office, and very pleased that Kieran Moore is so on point as well, and I have to acknowledge him for his work in the public health arena as well. And I'm also very happy to say to this room that through some of the work that I've done with local stakeholders in our community, of which you are one, and Loving Spoonful is another, we have built a draft, and I am working on that draft of a private member's bill that discusses exactly that. It will encompass healthy eating and physical activity in our school system. We also need to make sure that we work with the education system and that we have teachers on board, and that we either provide the support to them for them to be able to carry it out, or that we make sure that we provide additional support to work together with them and that it works for them as well. So I'm pleased to be ahead of the curve on that. Thank you.
All right. Gary, go ahead.
Thank you, Dennis, for the question. And like yourself, someone who's sat on the Public Health Board for 6 years, I understand the important role you do. The issue for me, though, is recognizing that a fully integrated healthcare system begins at the elementary and the school levels, and we need to be teaching more than just physical education. I think in many respects we need to be enhancing and improving the opportunities for young people to learn about preventive health strategies. We need to be ensuring that there's better opportunities for things like everything from home economics to actually growing gardens. I think there's so many things that we can be doing to begin people on those first few steps of leading a healthy lifestyle. My wife's been an early childhood educator for 35 years. She reminds me every day about the importance of educating young people and making sure those first few steps are healthy steps. So I can assure you that this is something that we need to focus on, and we need to work in partnership, I think, more closely. The education communities and the public health communities need to be better aligned so they both know what they're doing and they're reinforcing their efforts.
Thank you. Ian, your turn.
Thank you very much. I can't stress enough how important food is. I'm a chef when I'm not doing this. And the idea of preventative healthcare and teaching people how to grow and cook their own food again. And that's something I got to work on while I was on Kingston's Food Policy Council. The NDP wants to launch a provincial food and water curriculum so that we can teach people those skills again, because people have forgotten how to cook and how to eat healthy food. We want to work with the community of social services, or the Ministry of Social Services and Community, so that we can make healthy food more affordable again for people so they have access to it. It's such a, I am, every time I go out into the community and do a cooking course, teach people these basic skills, they get to take those home, and those are healthy decisions. And when I get to do that with children, it's even more important, because like we talked about, it does start in elementary school, and sorry, it's really important.
Wrap it up, please. Thank you. Andre, your turn.
Thank you, and thank you, Dennis, for your question. We strongly believe that preventative measures go much further than reactionary measures. We believe that, like all the other candidates have said, that it really starts at the elementary level. I would love to see a community garden on the grounds of every elementary school in this province, where students can learn to grow their own vegetables and prepare their own healthy meals. I would love to see the high school curriculum amended to make physical education mandatory all 4 years instead of just one semester in grade 9. I would like to see, increased smoking cessation programs. I would like to see more, an expansion of the dental screening program that the KFLNA Health Unit currently has in the elementary schools to identify dental problems early and to teach children about good dental hygiene. Because again, if you can prevent problems early, they're much easier to treat, instead of letting them get out of hand.
10 seconds.
And again, prevention applies to all areas of public health, and it's really an area that we need to focus on. And if I'm elected, it will be a priority of
Wrap
mine.
it up, please. Thank you, guys and ladies. Now, Andre Picard has spoken about this. Actually, you know what? Why don't we go ahead with the question from the floor?
Hi, my name is Allison Kern, and I'm a registered nurse in this community, and also the Kingston chapter president of the Registered Nurses Association of Ontario.
Welcome.
And my name is Deborah Lefebvre. I'm an active practicing registered nurse and a former executive member of the Registered Nurses Association of Ontario.
Our question tonight has to do with the decreased numbers in our registered nurses in Ontario. Tonight, as we spoke to many of our community members, they're well aware of the issue. They've listened to it on the radio, and they're aware from being in the hospital. The national average of registered nurses to patients is 839 RNs to 100,000. In the province, there's 703 per 100,000, showing a deficit of 20%. What are you prepared to do to increase the numbers of RNs in Ontario? Will you support improving patient outcomes and patient safety by mandating that any new hires in tertiary, quaternary, and cancer care hospitals are registered nurses?
Thank you. All right. So we will start with Ms. Koala.
Thank you very much, and thank you for your work.
Yes,
Thank you
we'll
very
need the
much. Allison and Deb, I really appreciate your work that you have done. And as I said, since 2003, and although sometimes it might not feel like it on the ground, but since 2003 when we came into power, we do have 28,000 more nurses in the province of Ontario, and 11,000 of those are RNs. So there has been an increase. You may feel, and in some of my advocacy days, the Take Your MPP to Work Day that I have engaged with the registered nurses of Ontario on, I think that it's important to maintain that dialogue, and if there are areas that you feel that we should be looking at that is beyond the additional 11,000 nurses in Ontario, then we can certainly have a conversation about that.
Thank you. Gary, go ahead.
I would agree that work overload in community hospitals and throughout Ontario, it certainly leads to early burnout, it leads to stress, and we've even seen signs of violence in the workplace as a result of quite simply understaffing areas of our hospitals. And certainly the nurses are you're the ones that are on the front line, and you're the ones that witness all this. The issue that you raised is patient outcome, which I completely agree, because this is where I think we've got the whole Ministry of Health and our approach to mental health and healthcare in general in Ontario wrong. Is we begin at the level of the Ministry of Health and we work our way down. We need to be talking about the impacts on the patient first and working our way up through the system. And I think the idea of developing appropriate measures for patient outcomes and demonstrating that clearly raising ratios, particularly in the nursing area where you and the PSWs are on the front line, we could clearly demonstrate there was good value in terms of ensuring it's a better patient experience in our healthcare system.
Thank you. Ian, your turn.
Thank you very much. Doug Ford has promised $6 billion in cuts for Ontario, and the best estimates are that is 75,000 jobs. And what that means is, if you break it down by riding, that's 600 jobs in Kingston. And I'm really curious if those are nurses' jobs that we're talking about, or if they're teachers' jobs that we're talking about. Instead of cuts, we are committed to a $19 billion investment in healthcare, opening 2,000 new hospital beds immediately, and lifting the hiring freeze on nurses to ensure that there are enough nurses in hospitals and that we get that ratio back to an acceptable level.
Thank you. Short and sweet. Andre, your turn, please.
So, as I spoke about earlier, we need to ensure that we have an adequate staff to patient ratio just to make sure that every patient coming through the doors of our healthcare facilities receives an adequate level of care. And if that means investing in our front lines and hiring more nurses and hiring PSWs, we will absolutely do that. And we don't need to spend any additional money to do it, because once we clean up the waste and the mismanagement at the bureaucratic level of our healthcare system, we can free up $90 million, as I said, by winding down the local health integration networks. We also believe that we need to invest in PSWs that perform home care. Again, because that gets people out of our institutions and back into their own homes.
Thank you. Robert, your turn.
Thank you for your question and for the hard work that you do for your clients. Nursing is close to my heart. I grew up watching my mom complete her RN degree. She was an RPN working shift work, and seeing her move through that process and knowing the good work that she does for her clients, I will always be a strong advocate for nurses. In 2014, the stats said that by 2015, 40% of RNs would be eligible for retirement within 5 years. So there would be a massive turnover in the profession. And that's why the Green Party is committed to investing in strong post-secondary education programs for nurses, like some that we see in our hometown. The bridging program between St. Lawrence and Laurentian, for example, so college students can move on to university to become nurses. We'd continue those programs, we'd further those programs, and that's particularly important in this day and age of an aging demographic, when the good work of nurses is going to be necessary to take care of the people that have built up this province. So the answer to your question is yes.
All right. I'm going to ask for something. So, Andre Picard has spoken, and all of you have mentioned Andre Picard, and I'm one of the people who follows him. I've read his books. He asks pretty provocative questions. And so I am going to ask a provocative question too. Canada prides itself on a universal healthcare system. We believe that it should be the envy of the world. However, patients whom I've treated and whom I've seen in the hospital and in my family medicine clinic describe universal healthcare systems in other countries that include more. They include dental, optometry, physiotherapy, medications, which none of this is really available for everybody in Ontario. Two-tiered healthcare is a dirty word in Ontario. But despite being a taboo topic, this already seems to be occurring in our province. How do you reconcile this contradiction? So we'll start with Gary.
It's true, in some ways we do have a two-tiered system, whether it's in pharmacare or physiotherapy. There's a variety of areas where we do have a two-tiered system. And we need to recognize that, and certainly Andrew Picard's position on a number of these issues is controversial, but the reality is we need to be focused on how we provide the best quality care in this province. I know a lot of my good friends up here, and they will remain friends during this campaign, I can assure you. But the reality is that our government, when elected, isn't interested in cuts. What we're interested in doing is recognizing that we're on a path of unsustainable fiscal concern, and if we don't get this turned around, we're going to have bigger problems than a two-tier care system. I'm certainly not supportive of a two-tier care system. I've studied many healthcare systems around the world, and you're right, we failed in many areas. We should have a universal pharmacare system. We're one of the few countries in the world that has a universal healthcare system that doesn't have pharmacare as a component.
10 seconds.
The Liberal Party have made an attempt in making a step in the right direction in terms of OHIP plus, but unfortunately it wasn't a smart step.
Thank you. Ian, your turn.
We are one of the only developed country in the world that has a Medicare program without a pharmacare program attached to it. And when Tommy Douglas brought in Medicare, he never meant for it to stop there. So in many ways, we are picking up off of that and continuing his vision by implementing a universal pharmacare program for Ontario. There are many countries that have two-tier health systems, and they do not work. They do not lower wait times. Even here in Ontario, the P3 models that the Liberals have tried, they're not doing what they're supposed to be doing. The NDP is fully committed to a properly funded, fully public healthcare system, and we will never back down from that.
Thank you. Andre, your turn.
Thank you. And, as the second Conservative candidate up on the stage tonight, one area where we really differentiate ourselves from Doug Ford and the Progressive Conservatives is that we believe public services should remain public. There are some things the public sector does very well, and there are some things the private sector does very well, but we believe healthcare is one of the areas that the public sector does really well. We do have a pharmacare plan that it's different from the NDPs and the Liberals, where there's really no plan in place to control overcharging and what people are paying for drugs. Our pharmacare plan is based on New Zealand's system, where the government itself is the primary purchaser of all prescription drugs dispensed in the province. So that means, we have 13.8 million people in Ontario. With that kind of buying power, we could reduce the cost of prescription drugs by up to 90%, making it affordable for everyone.
Thank you. Robert?
Greens believe in a publicly funded, publicly administered public system. But the reality is, we don't have a fully public system. We heard that there's dental care, mental health care, pharmacare. These are all areas that have the entry of private provision. And we want to roll that back. We want to have teeth in Ontario healthcare with the dental program. We want to take the HST off private psychologists, so it's kind of like a public subsidy for those services for people who are seeking that help for mental health care. And we want to make sure that every Ontarian can afford the drugs that they need, that they are prescribed. The way that we're advocating to do that is through bulk purchasing at a federal level, consulting with our federal colleagues lobbying the federal government to make that happen, and in lieu of that, providing an Ontario pharmacare program. So dental care, yes, public. Mental health care, yes, public. Pharmacare, yes, public. Always public, funded, administered. Thank you.
Thank you. Sophie, your turn.
Thank you. I do want to pick up on something that Gary said earlier, that he remembers the effect of the Harris years, and we're talking about, we have seen and heard that we will, if we got a conservative government, 5, 6, I've heard $10 billion in cuts, we're going to experience some significant changes if that happens. But I do also want to say that I believe that our healthcare system is the envy of the world. We are cited by many individuals in the healthcare field. I'm not saying that we can't improve, but I think that it's important to acknowledge that we have a very good system. I have many friends who are surgeons, who are physicians, specialists that we've talked about earlier, who have traveled on sabbaticals to many different countries in the world, and we do have an excellent system. Again, I'm not saying it can't improve, but I do want to say that it's important that we bring that forward. We also will be providing psychotherapy services to individuals through family health teams, so that's going to be part of our $2.1 billion investment over 4 years.
Thank you. All right. I'll take one last question, another question from the floor. Excellent. Maybe I'm not sure who raised their hand first between those two people in the back row. They're in the black shirts. Yes. Maybe one of you, you're wearing the same shirts, so maybe one of you could ask a question.
Hi.
Hi.
I think some of the candidates partially answered this question, but I'd like a more detailed answer. So we know that privatized services within healthcare often lack transparency, accountability, and cost us more. Do you agree that for-profit private services are detrimental to the goals of accessible care for all? And if so, what steps will your government take to reduce the penetration of for-profit private care into our healthcare system?
Ooh, controversial questions continue. I like it. Thank you very much. Ian, we'll start with you.
By expanding our healthcare system, by investing in it and putting the money that needs to be there in it, and knowing where that money is going to come from. It's not just debt leveraged against future generations, and that's incredibly important. We're going to invest in pharmacare so that we can purchase drugs on behalf of all of Ontario and bring prices down. It's 90% for generic drugs and 40% cheaper for brand name drugs if you're talking about New Zealand. And we're going to do it with dental care. Like I said earlier, one person goes into the hospital once every 3 minutes for a dental-related issue in Ontario. By providing that care, it's going to be public, it's going to be publicly funded. By opening more beds, hiring nurses, and investing in healthcare, the dollars that need to be in there, we have them and we know where they're coming from, and we will follow through on it.
Thank you. Andre?
Thank you. As I said, public services should remain public, no question. Anytime you privatize a government service, it ends up costing you more in the long run. Because the service doesn't cost you any less to deliver just because somebody in the private sector is delivering it. It ends, they might undercut the government for a couple of years just to gain that contract, but at the end of the day, somebody is making a profit on it, and we don't believe that people should be making a profit on public services. We will make the required investments in our healthcare system. We will ensure that every dollar put into that healthcare system is being spent appropriately. We will hire enough staff to ensure that we have an adequate staff-to-patient ratio. We will invest in community care. We will implement a pharmacare program that can lower the cost of drugs by up to 90%. We will look at the dental care issue in this province and see if there's anything we can do to keep fees under control, and that may include a tax abatement on those fees. It may include a tax abatement.
Thank you. Robert, your turn.
Thanks for your question. You asked if it was detrimental that private healthcare is coming into our system, and the answer is yes. We talked about two-tier a moment ago. Let's think about that when it comes to mental health. We know that 5 out of 6 children in our province who need mental health care are not accessing it Those who are those who have the parents who can afford to pay for it, and that is simply wrong. Greens are committed to, as I said, publicly funded, publicly administered public health care, and that includes rolling back the privatization that has occurred, that includes expanding the public services that are already available, and that includes new investments for a dental care program, for better pharmacare, and for mental health investment. So the answer to your question is yes, privatization is detrimental, and we all need to agree to work against that. Thank you.
Thank you. Sophie, your turn.
Thank you. And thank you very much for the question. I think that it's really important that we provide health care to constituents in our ridings and across the province with the health care that they need when they need it in the way that they need it. And I think as well it's important, there's been a lot of discussion about healthcare and how this integrates into the healthcare system. We are the only party who has brought forward the OHIP Plus program, and other parties voted against it. I think that's an important piece to remember. Free 4,400 medications, free for people under 25, and soon for people who are over the age of 65. I think that that's extremely important. If I have a sore knee and need to get a scan, and I can wait for a hospital scanner, or I can go to a clinic where I would use my health card and not pay additional funding, I would probably prefer to get that scan quicker, sooner than later, by using my card. Thank you.
Thank you. All right.
Thank you for the question. I'm going to borrow your microphone. Ian, I think my battery died. It happens in life. Thank you for the question. Our party certainly has no intention of privatizing healthcare services in this province. Doug Ford's probably been one of the most vocal people on the disaster of Ontario Hydro and what's occurred there when we turned over the controlling interest of probably Ontario's most valuable asset. So I'll be reminding Doug Ford every day of the disaster that's occurred with Ontario Hydro as a result of quite simply privatizing it. We know that when you privatize any organization or any service, the first motive is profit. And profit has no business in our healthcare system. And I can assure you that I'll be reminding Mr. Ford every day that I'm at Queen's Park that look what happened with Ontario Hydro. Let's not let it happen to our health system.
Thank you. All right. We've heard a lot of promises tonight. We've heard a lot of talk about hundreds of millions of dollars and billions of dollars. The reality is Ontario has an extraordinary debt. We are facing a debt of almost $400 billion. The interest we pay on that debt could fund the entirety of physician services or nursing services for 1 year. The local health integration networks, or LHINs, are organizations that have been rapidly expanded to decentralize healthcare. Decentralizing healthcare is meant to bring a local flavor to understanding healthcare system needs and trying to provide the services that are going to meet them. That said, the LHINs are expensive. The LHIN here in Kingston, for this region, the Southeast LHIN, has a budget of about $143 million. Unfortunately, the Auditor General recently reported that LHINs are of questionable value, considering the money we've put into them and we've invested in them. And that's what raises a troubling question for a lot of us. I don't think people mind paying taxes if they know they're getting good value for their money. If you think you're paying your taxes and you're getting a good return on it, kind of makes sense. I mean, that's the whole point of taxes. You're supposed to get services in return for it. But what do you do when you've got election time promises of injecting funding into a healthcare system that's struggling and an Auditor General who's pointing out waste in the system at the same time? So my question to the candidates, how would you reduce waste in the healthcare system? Because it's the other side of the coin. It's not just about putting money in, it's about making sure it's used well. And we will start. I've lost track. Who am I starting with? I think Andre, right? Yes. All right.
Thank you.
We're going to pick Andre.
I have already spoken to this issue 3 times tonight. The LHINs, they're not of questionable value. They are of no value. In fact, they are of a negative value to this healthcare system. They suck up millions and millions and millions of dollars, and in that same Auditor General's report, It outlines the 14 objectives that the LHINs are supposed to meet every year. Some of them meet 2 or 3, some of them meet none. So they aren't doing the job that we're paying them to do. So they've had enough time to get it together and start to meet these objectives, and they've failed to do so. So it's time to wind them down, get rid of them, and reinvest the money that we've been wasting on bureaucracy back into providing patient care. There's also waste in terms of fraud, and we have another plan to combat that as well. And there's also waste in terms of consultant fees, overpriced drugs, and again, we plan on addressing all of these issues and redirecting the healthcare funding to where it's supposed to go.
Thank you. Robert?
Navigating the healthcare system can be extremely confusing. It is very complex. Knowing where to go, when, who to speak with, and what your rights are as a patient is extremely, as I just said, confusing and complex. And one of the ways that we can find efficiencies in the system, which is needed, is to invest in navigators for individuals who are going through the healthcare system. I mentioned earlier that I was the ED at the Council on Aging, and we published a book called Navigating the Healthcare System, which was a pocket-friendly guide to anyone who needed to know where to go and when. So we don't need to cut in the healthcare system. We need to make sure that we have, obviously, strong public services, strong frontline workers, as I've mentioned in my other answers. But we're interested in helping people move through the system that is intended to help them. So a navigation program is one of the ways that we can find efficiencies in healthcare.
Sophie?
Thank you. And I disagree that LHINs are of no value. The LHINs provide a service whereby they can actually be that navigator. So if, for example, the case that you brought up earlier, Nadia, with the specialist, a LHIN may have an opportunity to say, okay, maybe there's 4.5-year wait list here, but what about going to Belleville or Ottawa, depending on the urgency of the situation? And I know the urgency of all of those situations are graded in particular. I think to remove LHINs would be to rip out the framework that exists to make sure that our health services are local and that they understand what the needs are in various communities. If you're thinking about rural areas, you need to know what services are available there and how do you address those gaps when healthcare is challenging to find. So I think it's important that we work with our LHINs and make sure that we support them. Thank you.
Gary?
Well, thank you. You raised the issue of the LHINs. Like I said in my opening remarks, I was a member of the District Health Council, so I have some understanding of what the hope and the expectations were when we had created the LHINs, and in some ways they've met those hopes and expectations, but I think in other areas they clearly haven't. I'm not going to jump all over the LHINs tonight. They're not here to defend themselves. But I think the real issue for our party and the real issue for all of us is the fact that there are limited resources in the system. Our current debt, and I appreciate you throwing that question at me, is $300 billion. It'll be $400 billion if any of these other major parties are elected. The current debt that we carry in this province carries a price tag of $1 billion a month. We could be building a hospital every month with that money. And that money is currently being funded, and the assumption is that the cost of carrying that debt will remain around 2.5% interest. We know interest rates are going to go higher. So one day we're going to be sitting here not talking about cuts to our healthcare system. We'll be talking about how to save our healthcare system, and that's why our party recognizes there is waste in our government. We're the only party that says we're going to go and start looking for it. We don't have to look very far. We just have to go to any one of the Auditor General's reports. The recent one of the last year demonstrated there was over $1 billion wasted in Ontario.
Ian?
I think we're already looking at how to save our healthcare system. And I got to ask, are you running for the right leader? Because he's promised to leave no stone unturned in his search of things to privatize. And we are the only party who's willing to recognize that, yes, we need to find efficiencies. We need to cap management salaries so that they are not exorbitantly high in comparison to the rest of this province. But we also need new revenue sources, and we are the only party who's willing to talk about that and increase the corporate tax rate by 1.5%. and increase the tax rate on income over $300,000 by 2%. And we're going to work with doctors and nurses so that we can find efficiencies that work with the staff who live this and work this every single day, and that's incredibly important. And we are absolutely committed to doing that throughout our first term.
10 seconds. Oh, excellent. Thank you, guys. And unfortunately, we're coming to the end. I'm going to give the candidates 1 more minute to make closing remarks, and we will start in reverse order of introduction. So we'll start with Sophie and work our way back to Gary.
Thank you very much. And again, thank you to everyone.
Microphone.
It just seems like such a good room acoustically. Thank you very much, everyone, again, for being here today and listening to all of our candidates. It has been a pleasure to be with you. I can demonstrate categorically that healthcare is an area of my work that I have been very dedicated to in the past 4 years, and it's the most important file that I have. I would continue to work very hard in this area and look for efficiencies without making the cuts that the PC party advocates for, unlike the current PC candidate. That's a little bit of a challenge. I'm not sure how he's going to manage that. And I think that it's important that we come together as a community and work together with doctors. I know that the relationship with doctors has been challenging, and I have already made a commitment that I will be working on repairing that relationship here locally and bringing forward ideas that they have and making sure that we're working on those provincially. Thank you.
Robert?
Thanks again, Nadia, and thanks to my colleagues on the stage and to you for your excellent questions. I wanted to close tonight by talking about a local health issue that hasn't been addressed yet, and that is Lyme disease. We know that because of the effects of climate change, Lyme disease on ticks and other vector-borne species is increasing. At one point, a few years ago, the estimate from the local public health unit was that 25% of ticks in our region had Lyme disease. And this is a tremendous problem for the people of this community. And I'm proud to say that Elizabeth May, who was the first elected Green in Canada, was able to put together a national Lyme disease strategy. And she was able to pass that bill in Parliament, even as a single MP from a fourth place party. The Ontario Greens are likewise committed to looking to the evidence, looking to grassroots organizations to make good legislation for the people of Ontario as it relates to health and as it relates to all areas of public policy.
10 seconds.
And the power of one green voice in Queen's Park would be game-changing. It'd be game-changing for you and our families and for the public policy that we need to address. And Lyme disease is a good example of that. Thank you.
Andre?
Thank you, and thank you all for coming out tonight. So on June 7th, you are going to make the most important decision you're going to make all year. You're going to decide which one of us 5 will represent you in Queen's Park. I just want everyone to remember that it's not a popularity contest between the elites in Toronto. It's an election of people from your community to represent you and your neighbors. We need to focus on what we're voting for instead of what we're voting against. So instead of thinking, oh, we need to get rid of Kathleen Wynne, or we need to stop Doug Ford from getting in, we need to focus on who can best represent our local interests and take Kingston and the Islands to Queen's Park instead of bringing Queen's Park back to Kingston and the Islands. It's time for something different and something better. Thank you.
Ian?
I'd like to, oh, not Ian.
Not yet. That was a really fast minute. Go ahead.
Thank you. I'd like to thank Health City Kingston for hosting us tonight. I believe that we must continue with Andrea's plan to build a grassroots movement that unites Ontarians in community and in caring. Because what happens to our neighbors or farmers or First Nations or retirees or new immigrants, it matters. It matters to me, and I think it matters to you. If people cannot access mental health care, that is a problem, and we will invest in that. If people cannot access home care or long-term care, that is a problem, and the NDP is going to invest in that. And if people cannot get the prescriptions that they need, that is a problem, and the NDP is going to invest in that.
10
I am running
seconds.
because I care, because of those words of love and hope and optimism from Jack Layton that made me not just vote for, but join the NDP in the first place. Thank you.
All right. Last but not least, Gary.
Thank you. I know during this campaign we're going to hear a lot of talk about Doug Ford and we're going to hear a lot of talk about cuts. The reality is the approach of our party, and our party is a team, it's not just one person. It's important that the leader does provide direction, but the reality is you're electing a team. And for me, I'm looking forward to working and serving the people of this riding. The real issue for me, and the reason I'm running, I'm not running to cut public services. I'm working, and I want to work to build the public sector in this community. We're going to be working hard to listen to people. I know everybody here tonight has talked about plans, and unfortunately that's the problem with governments, is they all have plans and the plans never work. We don't have to look too far back in history. There are opportunities for savings in Ontario. We don't have to look much further than the Drummond report, which the Liberals paid for and shelved. Professor Drummond teaches not very far from here at Queen's University. It's people like that that I think have ideas about how we can create better government that produces better value for all of us. We don't have to live through cuts. Like I said, I was the mayor of the city of Kingston. I know what happens to the impacts of cuts. And believe me, I was not a big fan of Mike Harris when I was mayor of Kingston. But if you want someone who will be on your side and represent you and will certainly have the ear of Doug Ford for the next 4 years, that's me.
All right. Ladies and gentlemen and really adorable babies who keep distracting me, thank you very much for being here tonight and for bringing amazing questions. You can see from the breadth of the questions, from nursing shortages to public health and obesity to privatization to LINs to funding to mental health to hospital shortages and physician shortages. You can see that healthcare spans a huge number of issues. It is a complicated problem, and there aren't going to be any easy answers. The fact that you're here tonight, the fact that you're here at Health City to learn about the system, to learn about what you didn't know, and maybe understand better what you already do know, speaks volumes about the interest that we have in our healthcare system. And it also gives me hope that somewhere within the conversations that we'll have here today, either with local leaders or with physicians, with nurses, with everybody who's involved with the healthcare system, somewhere we'll begin to find our way towards a solution. So thank you very much to the candidates for coming. These were tricky questions. You guys were fantastic for being such good sports about the whole timer thing.